Now, speaking of coronavirus, the Israeli COVID task force says that the daily caseload has already doubled in the past 2 weeks, with trends suggesting that the rate will double again in 2 weeks from now. So when will the vaccines finally be rolled out, and who will get them first? Joining me with more is Professor Manfred Green, Director for the Masters in Public Health program at the University of Haifa. Professor, thank you so much for being with us. Now, first, I understand that you can't tell us exactly what the plan is as it relates to who gets the vaccines and in what order, but can you tell us about the decision-making process itself? How do you decide the order of vaccine recipients?
Okay, there's several committees that deal with this issue, and as I mentioned, I'm on a couple of these committees. The whole idea really is to decide whether you want to get people vaccinated who are spreading the disease, or you want to get people vaccinated who are at high risk. In other words, which do you vaccinate first? So this is really a debate. And I think that in this way, I think publicly, from a point of view of the public, I think the public would prefer to see those at high risk being vaccinated first. And so that will, and I think it makes sense also professionally, because it really doesn't make too much difference which way you go. So that probably will be one of the first groups. And then the healthcare, and those who are caring for it, particularly in care homes, in elderly people's homes, that the people who are caring for them should be vaccinated.
So those at the highest risk group and those so those in the high risk groups, like the elderly and the infirm and with compromised immune systems, and then those most in contact with the virus, like healthcare workers. Those are who you suspect will be first.
That would be the second group. Yeah, and I think those vaccinating healthcare workers is really to prevent absenteeism and not making sure we have a full workforce, a healthcare workforce.
Well, in what way can the government, or will the government, be pushing and promoting the vaccine? Because obviously you need public participation for it to work in the first place.
Right. In a sense, I'm not too concerned about the pace at which that vaccination program will go. Even if you use a figure that we've looked at, that only about 25% of the public have said that they would be prepared to be the first to get the vaccine, that's still a lot of people. If you take 25% of the adult population, then we're well over 1 million people and somewhat more than that. So if they are the people who are going to go first, we'll be vaccinating a lot of people. And then I guess after that, you'll see that the acceptance rate of the vaccine will increase, and also the logistics will be improved. But it'll take several months. There's no doubt that this is not going to be a very rapid process.
Well, and especially, of course, with the fears of the potential long-term effects being unknown. Is that something that you think is going to prevent? Is that something that you think is going to prevent participation, or to a minor degree?
I've been working in vaccines for so many years, and I've not only received regular vaccines. As a participant, I've been in vaccine trials. So I'm not very concerned about that. Vaccines go through a very thorough evaluation before they're released to the public, even before they're released for trials. So even when they're given to people who go into the trial, they've already been very thoroughly investigated for any possible side effect. And then you see some of the side effects early on. So there's nothing really biologically that we are particularly concerned about with these vaccines. Obviously, we need to monitor this very carefully, and that will be done. But I would say that we're pretty confident. All of them are using technology that is actually well known, although they're not necessarily being used routinely, but they're all well-known technologies.
All right, now, final point, the head of the public health services at the Israeli Health Ministry is saying that obviously the exit strategy cannot rely solely on vaccines. Are you agreeing with this point? And if so, what else is it taking?
The answer is obviously too simple even to say it, but I'll say it anyway. We need collaboration and cooperation of the public. And, the simple process of using masks and social distancing or physical distancing are very, very effective. I'll give you just one quick example. We are virtually not seeing any other respiratory viruses, I'd say many of them, like flu, influenza, and so on. And one of the reasons is that these measures that we take with social distancing and masking and not crowding are actually very effective in preventing the spread of viral diseases, respiratory viral disease. So I think that if this is done together with the vaccines, we'll get there.
All right. Dr. Manfred Green, thank you so much. Professor Manfred Green, thank you.
Thank you very much.